we would have done it a long time ago.
Well, I mean, the 84% increase in discretionary spending in the last 2 years is outrageous, and all it's done is...
How much of that is stimulus spending?
Oh, quite a bit of it. But we've had a year-over-year 21% increase. Year-over-year.
Right. Let's say that that's all going to stop.
But Rox, what's happened is you had a baseline. Okay, then you had increases, and then you had the stimulus that increased. And now this is the new baseline. So it's not one-time spending. It's built into the baseline. And you can't do that. A lot of it is built into the baseline. It's built into the baseline today. The discretionary, yes.
David Walker, the former Comptroller General of the United States, was in recently when he was here for a Concord Coalition event, and you know he served in the Bush administration as well as in the Clinton administration, and he talked about the need for a lot of things to happen, not just spending, not just cuts in spending, and not just growth in the economy, but also tax increases, because long term, you know, not in the next 2 years or 3 years, but longer term, only doing all those things together in a sustained way will get the deficit in hand. Do you think he's wrong?
I think you have to prove that you can cut spending before you can have any kind of conversation about an increase in taxes, because the American people will not stand for it. The idea that, I mean, as an example, last year, I'm ranking member on the Transportation and HUD Appropriations Subcommittee. I had an amendment that saved $800 million by changing the formula as far as the folks who want to have the reverse mortgages on their homes. Okay, my amendment was to put that $800 million toward the deficit. They would not allow that. It had to be spent someplace else. They said that your policy is right, but we're going to take that money now and spend it someplace else. There is no one in the current majority who wants to save any money and not spend more dollars. Now, you're not going to have any credibility having to do any of the other things you're talking about until you are serious about cutting spending.
But there's been lots of spending when Republicans have been in control of Congress and the White House, too. This is really a bipartisan problem, overspending.
It's spending on steroids now. I mean, it's just nothing.
I think it's worse than it's ever been.
We have never had in 2 years an 84% increase in discretionary spending.
Do you think the stimulus was a mistake?
It was, obviously.
Why is that obvious? Can you elaborate on that?
Well, because when it was proposed, the president said that, you know, unemployment at that time was 7.5%, that it would not go above 8% if it was put in place. Unemployment is 9.6%. It's been hovering around 10% now for over a year. We lost 95,000 jobs last month again. So it's obviously, it's all it has done is piled on a massive, about $1.1 trillion over 10 years with interest on the national debt, and had unemployment go up. The problem with it was never focused on creating jobs. It was focused on growing government. We've had an increase of about 400,000 new federal employees, while the private sector has lost about 3 million. So, I mean, the emphasis was all about growing government. It was not about putting jobs in the private sector. They talk about infrastructure. I mean, only 3.8% of that whole bill was actually had anything to do with roads, bridges, those type of transportation infrastructure dollars. And because it was, quote, you know, shovel ready, it was basically we're going to go out and put new paving on top of current roads. And those are not long-term jobs. This is not an investment in infrastructure long-term. It was just a one-time kind of shot in the arm. And you listen to anybody about the effects of the stimulus, and they'll tell you, yeah, it had a little temporary boost, but it's not doing anything long-term. A lot of the money hasn't even actually been spent, only about half of it. Actually, the check's been written. Now most all of it has been committed to spending in the future. But it was never designed to, the way they designed it, it was never meant to create jobs. It was meant to grow government.
What does a Republican stimulus program?
Well, and what we proposed and what I supported was to at least double the amount of money going into infrastructure that would have actually created some jobs, reduced taxes immediately on small businesses, and by Christina Romer's own formulas, who was the president's economic advisor, it would have created twice as many jobs, quote, I mean, wherever the jobs are that they talk about all the time, twice as many jobs and cost half as much. It would have actually put focus on the private sector, created jobs in the private sector rather than just growing government.
Focus on infrastructure without doing the overlays, which you can start immediately. How do you build highways and buildings and sewers in a short period of time that you need for an economic downturn without plants ready to go? I mean,
well, no, and you're exactly right. But they're right now, and like I mentioned before, if we actually had a highway bill passed, new authorization, and the president talks about $50 billion of another stimulus infrastructure, the best stimulus for infrastructure would be to have a highway bill where there's certainty, so that the states right now can't let long-term contracts because they don't have any certainty of going forward what money they're going to have out there. And that's the biggest problem the states have. And you look at how you plan for a highway or new infrastructure around Des Moines or Ames or wherever, you can't do it today because it's herk and jerk all the time. And we've had to backfill currently to even make our commitments today in the last year and a half about $30 billion out of general funds to honor our commitment to the states the way it is. I mean, we've got to have some certainty out there, and to kick the can, the Congress has just totally not done their job. I mean, when you look at the highway bill, if you look at passing a budget, giving any certainty as far as taxes are concerned, I mean, it is just throwing up their hands and say, we're going to go home.
Do you think the stimulus bill saved jobs, though, in the state, in your district? Because our state budget would have been in real
maybe
trouble.
Temporarily. There's nothing permanent in it.
Medicaid, the additional Medicaid money, which has helped thousands of people get insured, did you support that aspect of the stimulus?
I didn't support the stimulus at all, no. Because if you actually had jobs, you wouldn't have so many people on Medicaid and so many people in the system. I mean, if you want to talk about, and that's one of the real problems we have, the way that the Congress is operated. You have all of these different things thrown into great big bills, written in the middle of the night, in the Speaker's office or in Harry Reid's office. And you know who's most frustrated about this are the Democrats in the majority. Because they have had no say. When you look at the health care bill, when you look at the stimulus was written in David Obey's office from Wisconsin, when you look at cap and trade, those things were all written in the back offices of the leadership, whether in the Senate or the House. And the most frustrated people are the Democrats who actually were elected to go to Washington and represent the districts, but they haven't had an opportunity to do so because they've been totally shut out of the process. I mean, as someone in the minority, when you're down 80 seats, you know, you don't expect to get everything that you might want. But the fact of the matter is the people who are really shut out are the people in the majority who have had no say in what these bills are.
So if you assume going forward that, I mean, let's assume just for the sake of discussion that you would, if you were reelected, you would continue to be in the minority. Is there, I'm just, for the sake of discussion, is there any...
Let's just stipulate that I don't think that would be the case.
Okay, but if it were, if you found yourself in the same situation going forward, what could your constituents expect you to do differently? I mean, you know, I also think we can talk about, you know, sort of how it has been and the frustrations, but in a, you know, constructive way going forward, are there any things you personally could do any differently to try to make movement on any of this?
Well, I mean, encourage leadership on both sides to actually have a fair and open process, to have something that would be unique to the current Congress, things like markups in committee, maybe having amendments on the floor of the House, you know, things that are not coming to the floor of the House under closed rules where everybody's shut out of the process. I mean, it is, the cap and trade bill was filed at 6 o'clock on a Thursday night. 3 o'clock in the morning they offered, and it was like 2,200 pages, 3 o'clock in the morning they offered a 300-page amendment, manager's amendment, to vote on at 9 o'clock in the morning. Nobody knew what was in that. And the health care bill, I mean, you remember Speaker Pelosi saying, we won't know what's in this bill until after we pass it. I mean, it is absolutely outrageous what has gone on. And the fact of the matter is, we still don't know what's in the health care bill because there are thousands of rules that are going to be written and regulations written with the statement in the bill, the secretary shall determine, or the secretary shall write this rule. We don't know what the health care bill is going to be outside of a massive tax increase, outside of huge cuts in Medicare as far as new regulations. The fact most estimates say you're going to have to hire about 16,000 new IRS agents to enforce the health care bill.
So,
I mean, those are the things we kind of know about, but how it's going to be implemented, nobody knows.
isn't the $500 billion cut in Medicare actually a reduction of expected future increase, as opposed to
I
cut on
remember
the
very
base?
well you folks accusing me of cutting food stamps and everything else when we were just
But is that true
slowing
on
the...
Medicare?
No, it's a cut.
From the current base?
I mean, I'll show you some emails we've got from I won't because of privacy, but I've got constituents saying I had a Medicare Advantage plan that I love. I just got that's what the $120 billion of cuts are in Medicare Advantage plans.
So one of the things you talked about earlier was...
But he doesn't, and it was promised in the bill that you would be able to keep the policy you had. That's a lie, isn't it?
One of the things
It's an absolute lie.
One of the things you talked about at the beginning was the need to rein in spending, and you talked about Medicare as one of those. Should people expect all the same benefits from Medicare going forward that they have today? Do we need to take a fresh look at what are reasonable levels of benefits? Who should receive them?
I don't think I don't want a bureaucrat in Washington picking who gets and who doesn't get coverage. No. Decisions should be made by the doctor and the patient. And what the health care bill with the intervention you're going to have is that relationship basically destroyed today. But in Medicare, we've got,
How so exactly? The doctor-patient relationship?
because you're going to be told, and these policies have not been determined yet. I mean, that's another thing. No one knows what's in the bill because no one knows what their policies are going to look like. It will tell you what procedure is paid for and what procedure is not paid for.
Medicare
Right.
does that already, right?
Well, and but in the health care bill,
How will we
rarely.
rein in spending if we don't
got to
continue to
reform.
decide what Medicare will pay for and what Medicare won't pay for?
Well, you've got to protect Medicare to begin with, because people rely on it. And cutting over $500 billion out of it to fund a separate new entitlement is simply wrong. That does nothing to shore up Medicare. Does nothing to provide services to Medicare patients. Now, if you want to have a bipartisan agreement how to reform Medicare going forward that saves the system for everybody involved, that's fine. Sign
I'm
me
trying to understand
up.
your parameters for what would be acceptable to you in reforming Medicare. I mean, do Americans need to get used to the idea of a different level of benefits that maybe they have expected up to now?
I don't think you have to. I think if you reform the system, if you actually had things like medical malpractice reform, if you had technologies, there's plenty of savings you could have there to actually shore up the system and still have people the expectations they have for coverage. I mean, I've got an older brother who has just gone through with cancer in a process that's going on about 9 months now in Rochester. I mean, are you telling me that because he's